when looking at closing angle joint pain, what we're talking about is pain that occurs when going into a stretch or mobility or any sort of exercise when the joint is closing, so the joint is getting smaller. So for example, common area this people experience this in is the hip. So if I'm bringing my hip up, this angle right here is closing. So as this angle closes, I should start to feel more of a stretch. I'm going to feel stretch and back here, the muscles that are being stretched. If I start to feel a pain or a pinch in here, this is what we call closing angle joint pain. You do not want to push through this, as this is typically the bone is pushing on another bone in the area. You're just going to cause it to flare up more if you push through it, so don't push through it. With any exercise that we're doing, you can work around it, so just work in the pain-free zones, or you can also go around that specific area of pain into other pain-free areas. For example, if we're looking at the neck, for like the Carr's rotations in the neck, as you go through it, if you were to get pain here, stretching here is fine, but if you're going to get pain here on this side, instead of just pushing through that pain every time, I'd have you come here, you know where the pain is at, kind of come off a little bit, and then go back in through the rest of the range. That way you're still training all the ranges, but you're not flaring up that one area. The other thing you can also do is just working on the different lift-off, pails and rails, that stuff in that pain-free zone. That's going to help the issue, and then as you notice that you have more range, more pain-free range, you'll slowly just improve until that sensation is gone. We also recommend that you go get checked out by a doctor or a physical therapist or someone who can help deal with that, as they can help speed up the process usually to help improve that. But once again, closing angle joint pain, don't push through it. Another example is if you're squatting here, you start to feel a pain in the front of the hip here in the joint or in the ankle. As you're coming down in the front of the ankle, those are both areas that you do not want to push through, so we'll work around them.